So beating the heat, tips for a healthy and happy summer. Again, my name's Cody. I'm a professional health coach with the digital medicine program. Um, some things we're going to go through just for content overview is just tips for your home, staying active, keeping cool, some smart foods and drink choices, and then to finish up, sleep hygiene. So starting off first with tips for your home. You are airing out your home during the summer. So just letting in fresh air by opening up windows. You should be doing this at least 5 to 15 minutes every day or every other day. With airing out your home, just make sure you're not doing it during poor air quality days or during peak heat hours. So early mornings, late afternoons is probably best, probably avoiding middle of the day. But just to kind of air out your home, putting fresh air in your home can really kick off this clean, beneficial summer. It can help replace that stale air in your home with fresh air from outdoors. Along with airing out your home, make sure you're deep cleaning. So dusting, mopping, wiping down surfaces. This can all really help with symptoms of asthma, COPD, getting rid of dust and dust mites. And then lastly, just checking your local air quality. That's also really beneficial for those with COPD and asthma, making sure that on high air quality days, you're not doing those home air outs. And then you're also just avoiding outdoor activities just to lower those symptoms that you may experience. So coughing, wheezing, all of those things. Next up is just to move more and sit less. So getting creative with exercise to maintain a good routine, even as rise outside. The goal is to try reaching at least 150 minutes of aerobic exercise every week. So getting outside, exercise in the early morning, late evening is best. Outdoor sports, walking, running, swimming, even ball games, family events, all of those things can be fun to get outdoors, get moving, enjoy the summer weather. If it is too hot outside, always make sure you're cooling off. You can always visit a gym or play inside with active video games, chair exercises, stream YouTube videos, anything like that, or even family indoor activities can be beneficial. With exercise, it can actually aid in blood pressure management by reducing your blood pressure 7 points within 4 to 12 weeks. Next up, with those outdoor activities, if you are going to participate in them, keeping cool in extreme heat. I know temperatures have been hot lately, so of course, main goal is always checking your temperature daily. Using sunscreen and protective gear. So when wearing protective gear, just make sure you're wearing lightweight or light colored clothing. Anything that's loose fitting can help sweat evaporate and help keep you cooler. Of course, if possible, always wear a hat and make sure it is a light colored hat with a wide brim. Make sure you are staying hydrated as well if you are participating in those outdoor activities. You do want to make sure that you're drinking plenty of water. Try not to wait until you start to feel thirsty. Keeping your body up to date with drinking water can help your body sweat, cool down faster by drinking it frequently throughout the day. With checking your temperature, if it's too hot outside, you're not up to doing outside activities, you can always switch to those indoor activities. So again, those virtual games, active games, or even indoor activities with your family, like visiting a museum or something else that can be fun for the summer. Next up is going to be different types of foods. So eating the rainbow, incorporating more fruits and vegetables into parties and activities that you're having during the summer. With staying hydrated, any type of water-rich fruits can help you stay hydrated, even vegetables. So watermelon, cucumber, things like that. To help incorporate fruits and vegetables into different types of partying activities, some ways that you can do this is bringing a vegetable or fruit tray as like an appetizer or a snack to kind of snack on while you're there. Other ways are grilling different fruits and vegetables. So grilled pineapple, grilling zucchini. You can also go for a fruit-based dessert. You can do something like a watermelon pizza, using the watermelon as the base, topping it with yogurt, granola, different types of toppings like that, just to make it fun for the whole family to use and eat. Next up is just going for your whole grain options. Swapping out whole wheat pasta for regular pasta can aid in carb reduction and also benefit your blood sugar. And then, of course, lastly, is just to avoid dining out and make it fun to cook from home. So trying different recipes with your family, trying new foods, maybe something that you haven't tried before, just to cook together, have fun in the kitchen, and avoid, again, dining out with those outdoor meals. Next up is rethinking your drink. So when making your drinks for the summer, always try to choose flat water, sparkling water, or unsweetened drinks. If you need more flavor in your drinks, you can always infuse them. Some great ways to infuse your drinks can be to use vegetables or fruits. So some great examples can be fresh cut strawberries, mint, cucumber. You can do a blueberry and mint infusion or even a watermelon basil. With these infusions, just leave them in your fridge for a couple of hours and they'll be good to go to drink throughout the day. Next up is not to buy it. If you don't buy sugary drinks, you're less likely to drink them. If you're at a coffee shop, always ask for sugar-free flavors if it's available. It can help lessen the sugar intake in that drink. And then if possible, asking for low fat or fat-free milks or even almond milk or oat milk as a milk alternative. And then if you're on the go, always carry a reusable water bottle. If they have areas where you can refill it at the store, or if you're at a museum or doing something fun at the park, make sure you're refilling it throughout the day. Makes it easier to keep that water bottle on hand and keep yourself hydrated. Next up for Rethink Your Drink is alcoholic beverages. The goal is to limit alcohol intake to 1 drink a day for women and 2 drinks a day for men. Reducing your alcohol intake can significantly lower your blood pressure as well as your blood sugar. Utilize alternatives for low sugar content. So you can do sparkling water versus fruit juices, such as like pineapple juice, cranberry juice. A serving of alcohol can contain about 100 calories, and doing mixed drinks have even more. So using those alternatives can help lower the calorie intake as well as the sugar intake in your drinks. For those alternatives, you can always flavor your alcoholic beverages with low calorie mixes like Crystal Light, fresh lime juice, fresh lemon juice, or even muddle fresh fruits in your drinks. And then overall, reducing your alcohol intake can lower your blood pressure by 7 points within 4 to 12 weeks. And then lastly, for a healthy summer is going to be sleep hygiene. Most of our summer nights are spent with our family, friends, we're having fun, we're doing all of those activities. But of course, don't forget your rest. Rest is very important, and not getting enough sleep is associated with increased hunger, higher blood sugar and blood pressure, poor concentration, frequent illness, and impaired problem solving. Some tips for a better sleep is to set a bedtime and stick to it. The goal is to try shooting between 9 and 11 p.m. every night. And it is recommended to get about 7 to 9 hours of sleep per night. Next up is just try to turn off your electronics before going to bed. This means lights, TV, cell phone, tablets, computers, anything like that, at least 1 hour before bedtime. Try keeping your bedroom dark and cold. This can help stimulate melatonin and make it easier to fall asleep. And then lastly, just relax before you head to bed. Doing any type of reading, meditation, stretching, journaling at least 1 hour before you head to sleep is beneficial to, again, help you fall asleep faster. And then, of course, caffeine and alcohol intake. Try to keep it to a minimum in the afternoons and evenings to help you fall asleep when it is time to go to bed.
Okay, thank you, Cody. That was great. We're now going to switch to the digital medicine portion of the webinar. She's going to go over all the benefits and what we include in the program. Again, just please ask any questions in the chat box and we can stop and talk about them. And again, this is going to be recorded and sent to everyone. So if you do want to look at something longer, just look out in your email. But Cody, you could take it away here. We're going to talk about digital medicine now.
Awesome. So Ochsner's digital medicine program is a holistic approach to disease management. We monitor high blood pressure, type 2 diabetes, and high cholesterol. In this program, it's more than just monitoring, it's personalized care that drives results. We give comprehensive solutions that offer medication management in addition to lifestyle coaching from your health coach. It's a completely digital experience, so you can be anywhere to monitor your blood pressure or your blood sugar. And it's designed and delivered by a healthcare provider. So how the program works. Step one is to just take a digital reading. So as a patient in the program, you take a reading using your personal connected device. The readings are transmitted to your medical record via your smartphone application. Step two is the support and treatment intervention. So ongoing support through phone calls from your care team, in-app messaging, monthly progress reports help the patients have tools that they need to stay on track. And then step three is ongoing feedback via multiple channels. So it's based off of real-time data. Your care team proactively reaches out and provides ongoing support, treatment intervention if needed. For your care team, you do have a personalized care team that's dedicated to help you reach your goals. Your first care team member is going to be a clinician. It's typically a pharmacist or a physician's assistant. They all do have an extensive training. PharmDs are typically a doctorate level. They help manage your medication and stay on a correct medication regimen for your disease state. They can identify and address additional challenges, including medication affordability and reversible causes for the disease. Your health coach on your care team, they do come from diverse backgrounds in allied health fields. We use integrative data and detailed personal and social history for patient profiles to provide education and support meaningful lifestyle changes and a completion of health maintenance goals. We're here to help identify barriers and increase patient health compatibilities. And then lastly, we have a support team there for you. Our support team is made up of customer service, technical support, and concierge representatives. They're there to assist any patients in the program with general questions, enrollment, any technical support, or any other digital medicine specific needs if they arise. So next up are just some clinical outcomes for the program. With the blood pressure program, we can see that after 6 months in digital medicine, patients achieving their blood pressure control goals goes up to 79%. And then medication adherence increased as well as the longer patients participate in the program. And then same thing goes for our diabetes program. After 6 months, the goal for A1C is 7%. And we can see that those goals have increased the longer patients participate in the program. So program perks for employees. We do have exclusive program perks if you are an Ochsner employee. First up is a $0 copay on select medications when you fill at an Ochsner pharmacy and wellness location. If you do happen to join the program, your digital blood pressure cuff and or your glucometer are provided to you at no cost. Ongoing blood sugar testing supplies are also provided at no cost as well. You can earn monthly Limeade points for active program participation. So if you're doing Limeade through insurance, you can get those points. And then lastly is a $100 cash incentive if enrolled by October. Wanting to learn more or getting started, make sure you do have the new My Ochsner application downloaded. You can open the My Ochsner app and then complete the digital medicine questionnaire that's located in the My Records tab in the main menu. So just following the instructions listed here, going to My Chart, your main menu, clicking My Records questionnaires, and then it'll bring you to that digital medicine consent. And then if you don't see your questionnaire, you can always visit this link right here, ochsner.org/beattheheat to get started.
Awesome. Thank you so much, Cody. So if you have any questions, feel free to type them in the chat box and we can discuss anything you need to talk about. The link is our landing page for you to go find any information that you just viewed if you want to read more. We do have a Twitter, Facebook, and LinkedIn. So if you want to follow us, we post multiple times a week. Our next webinar will be September, and we'll have a whole new topic to talk about. So be on the lookout for that email as well. But please follow us. We post lots of great things all the time. I see a question. What about family members of Ochsner employees? So we have a different program for people who do not work at Ochsner. It works the same way. You get the same program incentives, but for Ochsner employees, we have those specific qualifications. But they are more than welcome to join. We do have a patient-facing webinar a week from today, next Wednesday. So if they are interested in joining, make sure that they sign up for that one. This one was exclusively for Ochsner employees, so those slides you saw were just for us. But yeah, have them sign up next Wednesday and they'll learn about it from a patient standpoint. But
And I'm sorry, Ashlyn, I can also piggyback off of that as well. For family members, of course, they won't get the Ochsner employee benefits. However, if they do have an active diagnosis of hypertension or type 2 diabetes, they are eligible to join the program. So they can always talk to their doctor, see if they're interested. They can get more information from their doctor to put in those orders to join the program. But again, just like Ashlyn said, they can always join the patient-facing webinar next week. That way they can learn more about it.
Yeah, I see another question, recipes. We do post some awesome recipes on our social media. So if that's something you're interested in, give us a follow. I don't know if on our website we have any posted, but we can definitely look into having some always available on our digital medicine website. I can look into that. But yeah, if you want, just follow us and we post some recipes every now and then. And yeah.
And if you do happen to join the program as well, you can speak with your health coach and talk about those recipes. We do have a wide variety of resources that your health coach is able to send you regarding snacks, meal preps, things like that. So you join, talk to your health coach, they can kind of help you more personalize and look specifically what you're asking for.
Yes. And I see another one. How do patients sign up for next week? So next Wednesday, also at noon, we'll be doing the same thing, but patient facing. So if you follow us or go to our social medias, there are registration links. We do have an event created on Facebook that has all the information with the registration link. It's called Beat the Heat, a live webinar presented by Ochsner Digital Medicine. So just go there, you'll see a link, just make sure you register and then they'll get emails with directions on how to join, just like we did here today. So that's going to be a week from today. We're going to also post and advertise some more. So just be on the lookout for that. But basically the same thing we did, but for next Wednesday. Any more questions? Just a reminder, this was recorded and we will be sending it to everyone. Lucy, how are you? I see you raised your hand. Lucy, if you have a question, just type it in the box and I can go over it. I want to say thank you for everyone joining. It really means so much to us having people here. We put a lot of work into these webinars and we want to provide y'all with the best health coaching possible. So thank you so much. Lucy, if you have a question, I saw you raised your hand, but just type it in the chat box. We will record this and email it to you. So if you do want to respond, Lucy, to the email. Oh, it was an accident. It's okay. Well, nice to see you, Lucy. Thank you everyone for joining. Be on the lookout for an email. And again, the webinar next week for patients is on all our social media. So if you have anyone in mind, just go to our platforms and you'll see the link. But other than that, I hope everyone has a great rest of their Wednesday, and we look forward to seeing y'all next webinar in September.
Thank you, everybody. Y'all have a great rest of your week this week.